very warm welcome to all my viewers. So, a very highly demanded topic about contraception. I have got multiple requests to make a video on this. So, as exams are round about the corner, the practical exams coming up for the postgraduates, first I'll be talking about the progesterone only pills. So let's begin with that. To those who are new to this channel, hi, I'm Dr. Sonali Jagati, Senior Resident Obs and Gynae at SCB Medical College and Hospital, Qatar. So first, try to understand that we are talking about progesterone containing contraceptive. Progesterone only containing contraceptive are of three types, okay? So one will be oral, one will be injectable, and one will be implant, okay? These are the three types of progesterone only contraceptive. I have already made a video on progesterone containing implant, that is Implanon. I'll post the link in the description. You have to see this video before your practical exams. It will be very helpful for you in your viva. Next is the progesterone only pills, which is oral contraceptive. As the name suggests, these contain only progesterone. And they are also called as mini pill. This is because they contain very low dose or very less amount of progesterone in comparison to OC pills. This can be in the form of levonorgestrel or desogestrel. Before I move further in the topic, I'll just tell you that this particular PDF I have taken from the NHM website itself. So this is a direct screenshot from the Government of India guidelines. This is highly recommended that whatever you read in the topic of contraception, you have to read from the Government of India guidelines, because these contraceptions or contraceptive methods are provided by the Government of India, and they have given their clear-cut guidelines. So you have to follow these only. Remember that POPs are safe and effective, and they are safe for breastfeeding women. This is very important. You can start immediately after delivery, earlier than 6 weeks in comparison to OC pills. Remember that the bleeding changes are a major side effect, but they are not harmful. Most important point to be remembered when you're advising someone POP is that the one pill has to be taken every day at the same time, because the window period that we get here is only 3 hours, okay? So remember that she can maximum delay it only up to 3 hours. So beyond 3 hours, if she has forgotten her pill, then again she needs a backup contraception. So when do you start POPs? Most ideal time is within 5 days of a menstrual cycle, with no need for a backup contraception. This is true for any oral contraceptive, in fact, because this is the time when the dominant follicle has not yet been recruited. So this is the time where there is least chance of becoming pregnant. Also, the hormonal levels in the body are very less. So the effectiveness of the contraception is very high. So within 5 days of the menstrual cycle she has to start, and that does not need any backup method. If she starts or she comes after 5 days of her menstrual cycle, then you need to prescribe her another backup method like a barrier method or condom, okay? And this she has to take for the first 2 days of taking pill, and then she can continue only POPs. If she is breastfeeding and she is only less than 6 months, then also you can prescribe POPs anytime if she is not bleeding, and if she has started her periods, then just like how we told in a normal menstruating female, within the first 5 days. After miscarriage or abortion, she can start immediately or at least within 7 days, okay? There is no need for a backup method. If it is more than 7 days, then she should use a backup method like condom for the first 2 days of taking the pill. Remember that they are of the same color, unlike the combined OC pills, which come in a packet of 28 tablets, in which the first 21 tablets are hormone containing white pills, and the rest 7 pills are your iron containing pills, which are brown in color. So these POPs have the same color. They are active pills. all are active pills, that means all are hormone containing pills, okay, and they prevent pregnancy. One pill should be taken every day at the same time until the pack is empty. Linking it to a daily activity like after dinner will help her to have a better compliance and mechanism of action. Mechanism of action of progesterone only containing contraception first. Okay, so if it is progesterone containing contraceptive, they increase the cervical mucus. This is the predominant action of any progesterone only contraceptive. They increase the cervical mucus and thereby prevent the sperm penetration. Unlike the OC pills, whose first mechanism of action is to inhibit ovulation, but this is true for low dose or low progesterone containing contraceptive. High progesterone containing contraceptive, okay, progesterone containing contraceptive also inhibit ovulation. I hope you are getting my point. So if there is a low progesterone containing contraceptive, these include like your POPs, okay, progesterone only pills, they work by increasing the cervical mucus. But higher dose of progesterone containing contraceptive, these include your implanons and injectables, they will act by also inhibiting the ovulation. Next, one more important point that I want you to remember is about the drug, that is Cerazette. Cerazette is the only progesterone containing oral contraceptive which is available in India. Okay, it's the only POP which is available in India. This contains desogestrel. Desogestrel in the dose of 75 micrograms. Okay, this is a very important viva question. Cerazette is the only POP which is there in India, and it contains desogestrel 75 microgram. And what is the mechanism of action of Cerazette? This inhibits ovulation. For rest, every progesterone containing contraceptive, you can tell that it increases cervical mucus. But when they are asking you in particular about Cerazette, you have to tell that it inhibits ovulation. So what are its indications? Remember that the indications of progesterone containing contraceptive is very easy. Any women in whom oral contraceptive or estrogen containing contraceptives are contraindicated, in those only we will start progesterone only contraception or POPs. Remember that in breastfeeding female, the contraception of choice is progesterone only pills, because she can immediately start it and there is absolutely no effect on the quantity or quality of the breast milk. Also remember some of the side effects of progesterone only compound. So the most important side effect is the irregular or excess vaginal bleeding. Now these will subside in a matter of few months, and this can be treated with tranexamic acid, and proper counseling has to be done. Indicated obviously when you are suspecting pregnancy, in undiagnosed vaginal bleeding, and also in where you are suspecting breast cancer. POPs are concerned, missed pills is not that important, because the frame of time that we have got is only 3 hours. So it's obvious that any time that she misses a pill after 3 hours, she has to take that pill as soon as possible and use a backup method. Okay, if she starts having monthly bleeding, then she should use a backup method also for the next 2 days. And if she has had sex or unprotected sex in the past 72 hours, then she should also take emergency contraception. Remember that if a female is having vomiting after taking the pills within 2 hours, then she should take another pill. These are the most important points about progesterone only pills.